Welcome back, friends, to our show of comedy. My name is Herminio Alamo, a nurse practitioner.
I am Noel Figueroa, a psychiatrist, physician.
And we're going to be talking today with humor and health, right? That's what we do. And we have a slogan, right? What do we say?
Yeah, we actually had a problem because we came up with a slogan in Spanish. So this is the best translation. Please don't judge us. It's called, I'm telling you as a joke, but
take it seriously. So we're going to have humor and health, mix it up together with things that happen at work or, with patients or things that happen in our daily life.
Yeah, and the name CoMEDI actually is just two people, medi, like from medicine. So it's not a joke. It's actually something serious, maybe. But we want to talk about medical stuff in a lighter tone. So, you don't see all professional and all so stiff. No, we're going to be laughing and having a good time. And hopefully you will have a good time too.
Not to be confused that we're making fun of any patients or any disease or conditions. No. These are just funny anecdotes that we have in our daily life that we want to just bring it up because some people like that, the humor and health, and they say, you know what, the same thing happened to me, or I'm going through the same thing, and I'm probably not the only one that is going through this stuff.
And remember, laughter is the best medicine, really is.
Medicine. That's right. That's what they said.
That's why I'm so healthy, because,
That's why you look pretty healthy to me.
Yeah.
Okay, so speaking of healthy...
I'm always laughing, I'm always singing and all that. You can ask my employees.
By the way,
I have a song for everything.
How you like our new cups?
Yeah, these are cups. I look at them and I say, wow, this is so... I was saying that black and white, it actually fits with the white coat, and the set is... This is perfect. And this is from Italy, from Venice. From Murano Art. Yes.
A friend actually provided this for us, so I want to thank our friend for providing this.
Yeah, you can say the name if you remember.
That
would be something.
If it was a gift. Daniela, thank you so much. We really appreciate the cups from Venice.
That's right.
Italia.
That's right. And they actually float. No, just kidding.
And they are full of vodka. No, I'm just kidding. Water, right?
It's water, but I don't drink water because you know what? I get choked. And people say, how do you get choked with water? You'll see. I try later, and that may actually happen. So.
All right. Yeah. So what is the topic that we're going to talk today about?
Yeah, we were thinking about talking about the COVID, but not so much about the COVID, the vaccines and all the political stuff that happened with it and all that. We are post-COVID, and actually we had COVID, both of us, at the beginning of the year. But we are planning to talk about post-COVID complications, which a lot of people are going through right now. And I have patients that have different complaints of different systems, and we will be touching on those in a few minutes.
Yeah, we're going to talk about the long-term effect of what happened with coronavirus. And a lot of people are complaining of issues that they're having after, and they're not even sure if it's related to coronavirus or not. So first of all, there was something very interesting that I found out today in Florida, the state of Florida, for those first responders, right? I believe.
Correct.
I was talking to Dr. Figueroa here, and he was telling me a little bit about that. You want to elaborate a little bit of what
absolutely.
the law says?
I am a psychiatrist, and I dedicate my practice to see patients under workers' compensation. People that had been injured at work and developed psychiatric problems like depression, anxiety, traumatic brain injury, et cetera, et cetera. But one group of people that I also seen is a group of people that had been affected by the coronavirus. And you say, but doctor, how is that coronavirus part of a workers' comp case? Well, in the state of Florida, if you are within a group of workers that are at a higher risk of being contaminated, such as first responders, for example, policemen, firefighters / paramedics, correctional officers, and I believe nurses, physical therapists, etc. You are within a group in which if you do get contaminated with the coronavirus, and it is proven or there's a likelihood that it was product of being exposed at work, then you might be covered under workers' compensation, which can be a huge relief because a lot of the expenses of hospitalization, medicines, treatments, etc., can be covered under workers' comp.
That is excellent. Now, if you live in a different state, you're watching the program via YouTube, those
That's right.
YouTubers. Just want to tell you, check in your state because you never know if there might be a law there that will do this same thing,
The
the
same
same
thing.
compensation that we have here in Florida.
Absolutely.
So, what are those long-term effects? What can you name or tell the public here? We can't mention them all, but at least let's pick a few of what people are complaining, the main issues that we're having.
Well, I think that one of the first things that comes to mind is that a lot of patients had developed, obviously, severe problems with their breathing, and people had many times been hospitalized because of respiratory failure, because of shortness of breath, etc. And they came out of the hospital and not necessarily in perfect conditions. A lot of people develop chronic cough, which we talked about that earlier. We also have had people with reduced pulmonary functions, and they get fatigued easily. People that were more or less in good shape, they will walk a flight of stairs and will be very fatigued, tired, etc. So problems with their breathing is one prominent one.
Absolutely, and many times they do PFTs, pulmonary function tests,
Yes.
in these individuals in the past, just for physical exam. I'll give you an example. If somebody's a firefighter, they might have to do a pulmonary function test to make sure they're fit to do their
Absolutely.
job. But then after they had COVID, they do the same test. The pulmonary, it's an objective test. It actually shows there's a decrease in pulmonary function, and this was due after COVID, long side effects of
Absolutely,
it.
and again, it's an objective finding. It's not something that you can complain about and it's not verifiable. It's actually it was all good and normal before, and then after it's not. It's just as straightforward as maybe.
Okay. So just keep that in mind when you are looking at what symptoms you might have. Hopefully, none. Another one is joint pain. People always complaining, going to the rheumatologist. I think I'm developing arthritis. Maybe I have lupus. What is fibromyalgia? Maybe something is wrong with me, something exacerbated, something changed in my body after this. I wasn't this much in pain in the past, and this could be due to the COVID.
Yes, there is research and there's news every day about long-term effects of COVID, and we are learning as we go. But one thing is that in some cases we have seen like the origin or new things related to autoimmune responses. And as you probably know, autoimmune diseases can affect many organs. For example, rheumatoid arthritis, lupus, and others are autoimmune diseases that target different organs. And for some reason, maybe there is a possibility that COVID may be triggering autoimmune responses that can affect joints, for example, and can resemble things like arthritis of autoimmune origin. And people, yes, are suffering and having this, and it's not their imagination, it's real.
I actually heard of cases where people are having tachycardia, chest pain. They go to the cardiologist and they do a battery of tests. I call it the $100,000 battery of tests to make
That
sure
would be
the person
actually
is fine.
cheap.
That will be cheap.
That would be cheap.
So you think it's a lot more, right?
It can be.
It's probably more.
If,
It's like
if,
$1 million. The $1 million.
Yeah, if it's 3 days in the hospital and that includes Holter monitor, echocardiogram, EKGs, stress tests, cardiac enzymes, and sometimes cardiac MRI,
Yep.
it can be up there.
Okay.
Yeah, but at any rate, I have seen several patients that develop shortness of breath, and not in the sense of the pulmonary situation, but shortness of breath because of the chest pain, chest discomfort, and a lot of them actually had problems with palpitations and actually fluctuations of the heart rate and blood pressure as well. Again, people are not sure about the mechanisms of why this happened, but it is happening.
You know what? Now that you say chest pain, shortness of breath, another thing that makes me think of is that a lot of people too, after COVID, they have developed depression and anxiety. And when you're feeling anxious, you all of a sudden you tachycardia, you feel like you can't breathe, and you're thinking it's something physiological, and it's actually psychological. It could be both.
I was about to say,
Go ahead.
we have to think about both. As a psychiatrist, one of the things that when people come in and say, I'm having panic attacks, and they never had an EKG, never had any testing done, I always have to think that they have to have a physical examination done and also some lab work, etc. I remember a lady long time ago. This obviously is triggering my memory about past patients, but I always remember a lady that was complaining of tachycardia all the time, and we thought that again, yeah, she had some anxiety, but it was like too much, and she was a little bit dizzy sometimes. And one day I said, you know what, let me do some lab work. And the lady had a very low hemoglobin. She was very anemic, like
Wow.
with a 7.5, which caused tachycardia. And again, and she actually even had to have a blood transfusion.
Oh,
So
wow.
again, we have to think about not only the psychiatric symptoms, but sometimes psychiatric symptoms are a manifestation of something physical, and we need to pay attention to both. Which actually brings me to the point that we always say in our videos, and you will see this repetitive theme, that we always ask people to talk to the primary care physicians.
That's right. So we are making suggestions. We're talking about everything, but always go back to the primary care. I imagine you had a call from the primary care doctor saying, "Hey, thank you for ordering the CBC."
Yeah,
on
yeah,
the
absolutely. Sometimes, again, I even acted as a primary care physician because sometimes patients did not have one, or they're waiting to see their doctor was unreasonable. And I said, well, you know what? If the insurance pays for it, I'm just going to order it. And again, being a physician, I did have the power to do that. But one of the things that we have to keep in mind is that that medicine is not only just science, it's art, and you have to be suspicious of some conditions. And if you don't think about them, you'll never find them.
I always say that we always have to look for what is going to kill you first. So if the person is
That is true.
complaining of tachycardia or chest pain, don't think it's anxiety or depression. Just take them to the emergency room.
Absolutely.
I just want to make sure that it's not having a heart attack, the person, because that's what really going to save the person's life. You just want to be wrong, but if you're right, you just save that person's life.
I like that. I'm going to give you 10 points for that.
But let me just write them right. Excuse me. This is what we do in the Spanish channel, so that's another extra 10 points that I get. The other thing that I was going to tell is I mentioned CBC. CBC stands for complete blood count because
That is
I know
correct.
not everyone knows those little acronyms, so I just want to make sure that you know.
That is true. That is true.
So another thing, tell us about another symptom that you see in these long-term effects from COVID.
Yeah, I have seen patients also that complains of problems with the mental fogginess, that they were pretty sharp people. There were therapists, physical therapists, for example,
Psychiatrists.
nurses. I have not seen any psychiatrists with COVID other than me, fortunately.
Any fogginess lately? You know?
You know what? Let me see. I don't remember. Oh, yeah, I do have it. No, just kidding. So that is a problem with concentration. Some problems, even problems with sleep. And if you have interrupted sleep, et cetera, that can lead to problems with cognition and memory. So mental fogginess is being a problem. Concentration problems, anxiety, depression. There is also sometimes people that have kind of no drive, no energy. They just like, in good English, blah. You just feel blah.
They feel blah. Okay.
Blah.
Some people, another
Yeah.
changing the blah. Is that what you put a diagnosis? Blah. BLAH.
Yeah.
Blah.
Yeah.
And if it's really bad, blah blah.
Blah square.
Blah
And we
square.
actually, the problem with that is the billing. The billing to put the little two can be a pain.
That's I see the 9, I see the 10. They just
Yeah,
keep
but,
going.
yeah.
Well, what are we at now? I see
I
the
don't
20.
know.
Who cares? This is a self-pay clinic anyway.
That's right.
We'll do it for free, and he's not doing it anymore. So
Exactly.
this is great.
Yeah.
Another problem that we have is people that complain of headaches.
Yes.
They didn't have them before, or they have muscle pain. I had a patient that told me I could get in my car in the morning while I'm driving. It takes me like 45 minutes to get to work. When I get there, I have to call my coworkers to come get me out of the car. I cannot get out of the car. I just couldn't do that. For 2 months, this lasted. It got better with time, but it's still suffering from this body achiness.
Yeah.
So
Again, there's been literature that support the idea that in many cases COVID triggers autoimmune reactions, and also in many cases, actually, we were talking about this earlier too, that people that didn't have allergies, all of a sudden they have allergies to a lot of things, and where'd that come from? And again, I believe that it has to do with some activation of the immune system.
I'm allergic to work. You think that has something to do with COVID?
Yeah, now that you said that, yeah, just
I
kidding.
just kind of go to work and I was like, maybe I don't belong here. I'm just joking about that. Other things is fever. I had a patient that at the very beginning of COVID, I don't know if you remember that if you still have fever over 101, they didn't want to see you. Not even close, not even 100 feet close to the
Get
job.
out of my emergency room.
Get out of here. We don't want to see you. In fact, those people were testing negative and they were not infectious at all. But unfortunately, this is the long side effects from COVID. And at that time, at the very beginning, they didn't want them close to them. So they lost a lot of time from work. So that would be a good thing for first responders in Florida to get connected.
Absolutely. If you have the idea that you have contaminated with COVID at work because of your work, then in your state of Florida, and you can check. I think that you were right in mentioning that in other states there must be some parallel laws to cover for that eventuality. Because again, they are. I imagine paramedics are dealing with medical calls every day, actually even more than fires, and they are super exposed to coronavirus and any other illness pretty much. So they are quite vulnerable to these problems. The other thing that we mentioned in the Spanish video version is that some people may actually have a loss of smell, and they may not be able to taste the food good, which is that food is bad. That may be actually a good thing, but for the most part,
you have a wife that doesn't cook that great. You know, it's like, oh, honey, this tastes amazing. I just can't taste what it is, but it's actually
it looks good.
It's apple dog food. You know, it looks like something else, but you know, whatever. They're just fine with it.
That's right.
I was going to tell you that a lot of these side effects that linger for a while mimic something else. A lot of people develop dizziness when they stand up. And, you know, right away we say, well, that's orthostatic hypertension, you know, POTS, you know.
Yeah.
We just, I go with the acronyms again, you know. Yes. Orthostatic hypertension, when you change position. And this is something that is more frequent sometimes in patients that had COVID. And it's just so hard to differentiate this. We have to look at the history of the patient. So the primary care doctor is a great resource where you didn't have this history, where you never had this problem. And post-COVID, you start having these issues. Well, I just want to encourage everyone to go ahead and report this to the primary care physician.
I was about to say, yes.
Because we are still gathering data.
That's right.
On a daily basis, trying to figure out what are the long side effects of COVID.
Yes. And one thing that we will be telling you throughout these videos is to have a good relationship with your primary care physician, an open and honest conversation, that you can relate symptoms, even if you think they're minor. They always provide clues, and the situation will be better for them, and it will be better for you. And we want you to be as healthy as you can be. And I hope these videos bring you some information in an informal, light manner that you can enjoy and pass it on to other people. We want you to subscribe to our channel and to send comments to us, good, bad, or ugly. And we will try to suggest
they send all the bad ones to you. Just send me the good ones to me. The
topics
bad ones
that you want us to cover. We are starting the English version. So as you notice, and we will be doing a video related to our background. As you notice, my English is not too good. No, just kidding.
It's not very good looking.
It's not very good looking, like Celia Cruz used to say.
Okay.
But anyway, we want to do and these videos to reach the more people, the better, and provide this information to the public in general. So.
And thank you. And don't forget what we always tell the public.
I'm telling you as a joke, but take it seriously.
Take care, guys.
Bye.
Bye.